The question nobody asked. If I ask you right now, how's your mouth doing? I bet you immediately think about your teeth. Maybe whether they're wide enough, straight enough, or whether that filling in the bag is holding up. And I get it, we've been trained to think that way. The entire dental industry, the ads, the social media content. It all points to the same thing. Teeth. But here's the thing, your mouth is not just teeth, not even close. Your mouth is one of the most complex, dynamic, and underappreciated biological environments in your entire body. It has soft tissue, bone, nerves, an immune system, a fluid that does things most people have never even heard of, and an ecosystem of microorganisms that we're only beginning to understand. In episode 1, we talked about how everything starts in your mouth, how the mouth is not separate from the body. Today, I want to go deeper. I want to show you what your mouth actually is, because once you understand the landscape, you'll never look at it the same way again. Welcome to the Dental Longevity Show. I'm Dr. Mario Parra. Let's get into it. Let's start with the tissue that surrounds every single one of your teeth, your gums, the periodontium. This is the soft tissue that seals the connection between your teeth and the underlying bone, and most people don't give it a single thought. Here's what I hear in my practice all the time. Oh yeah, my gums bleed a little when I brush, but that's normal, right? No, that's not normal. That's your body telling you something is wrong. Bleeding gums are an inflammatory response. It means the tissue is reacting to something, usually bacteria that have accumulated along the gum line over time. Now you might think, okay, so my gums are a little inflamed. It's a local issue. What's the big deal? The big deal is that a growing body of research suggests this is not just local. When your gums are chronically inflamed, when that tissue stays irritated for weeks, months, even years, your body may respond systemically. A 2021 meta-analysis published in Frontiers in Immunology reviewed over 140 studies and found that individuals with periodontitis consistently showed higher levels of C-reactive protein, a well-known marker of systemic inflammation, compared to healthy controls. Let me put that in perspective. C-reactive protein is the same marker that cardiologists track to assess cardiovascular risk. And here we are, finding elevated levels in people with gum disease. That connection between a bleeding gum and what's happening in your bloodstream, that's not something most people are aware of. And this is just the gums. We're just getting started. Now, beneath those gums, there's a structure that almost nobody thinks about, the alveolar bone. This is the bone that literally holds your teeth in place. It's living tissue, it remodels, it responds to forces, and it can deteriorate. Silently. One of the biggest misconceptions in oral health is the idea that if it doesn't hurt, it's fine. Your jawbone can lose density and volume without you feeling a thing. No pain, no symptoms, nothing, until a tooth becomes loose, and by then, the damage is already significant. But I want to take this one step further. There's an area of research that I find particularly fascinating and that I think deserves more attention. It involves what are known as FDOJ, fatty degenerative osteonecrosis of the jawbone, sometimes referred to as jawbone cavitations. These are areas within the bone where the marrow has undergone a kind of fatty degenerative change. The tissue becomes necrotic. They often produce no symptoms at all. They can be completely invisible on a standard dental X-ray. A scoping review published in the International Journal of Molecular Sciences in 2025 described FDOJ as a condition characterized by what researchers call silent inflammation, elevated levels of inflammatory mediators, particularly a chemokine called rantis or CCL5, which has been linked in the literature to systemic inflammatory and even autoimmune processes. Now, I want to be very clear. This is an evolving field. We need more clinical data, more controlled studies. But what we do know is this. There are things happening inside the jawbone that conventional dentistry is not routinely looking for. And from a longevity and prevention standpoint, that matters. The bone beneath your gums is not just scaffolding. It's a living, immunologically active tissue. And we need to start paying much closer attention to it. All right, let's talk about something that everyone has but nobody appreciates: saliva. Most people think of saliva as just mouth water, something that's there to keep things wet. But saliva may be one of the most sophisticated biological fluids in your body. Let me give you a quick picture of what saliva actually does. Saliva is much more than just fluid. It plays multiple roles that are essential for oral health. First, it carries calcium, phosphate, and fluoride ions that support the natural remineralization of enamel, helping repair microscopic damage throughout the day. Second, it contains antimicrobial proteins such as lysozyme, lactoferrin, and histidines, which help regulate bacterial populations. Third, it acts as a buffering system. After you eat, the pH in your mouth drops, and saliva helps bring it back toward a safer range. And interestingly, saliva also contains growth factors, including epidermal growth factor, which are believed to contribute to tissue repair. This may be one of the reasons why wounds inside the mouth often heal more efficiently than similar wounds on the skin, although multiple factors are involved. A narrative review laid out in detail how salivary proteins like staphyrin and proline-rich proteins have a direct affinity for enamel surfaces, increasing local calcium concentration and facilitating remineralization. So when something disrupts your saliva, dehydration, medication side effects, stress, aging, you're not just getting a dry mouth. You're losing a defense system. You're losing your body's natural repair mechanism for your teeth. You're losing antimicrobial protection all at once. This is why I always tell my patients, saliva is not a minor player. It's central to everything that happens in your mouth. And we're going to dedicate an entire episode to it later in this series, because there's so much more to unpack. Now let's look at the soft tissue lining your entire mouth, the oral mucosa, and the remarkable organ at its center, the tongue. The tongue is a highly specialized muscular organ with a unique structure and mobility. It plays a key role in taste, speech, swallowing, and even aspects of breathing. Its surface, covered in tiny structures called papillae, can offer useful clinical information. Changes in color, coating, or texture may reflect local conditions, and in some cases, they can be associated with broader factors. However, these observations always need to be interpreted carefully and within a proper clinical context. The oral mucosa itself is not just a passive lining. It acts as a sophisticated biological barrier. It is constantly exposed to food, bacteria, viruses, temperature changes, and mechanical stress, and yet it maintains its integrity through continuous renewal and immune activity. When something changes in this tissue, recurrent ulcers, persistent white patches, or unusual color changes, these are signs that deserve attention. In some cases, they may be associated with local irritation, nutritional imbalances, or systemic conditions. This is why proper evaluation is important, because the mouth communicates, not only when we speak, but through the way its tissues look, feel, and respond over time. And this brings me to something that ties everything together: the immune system of the oral cavity. Your mouth is one of the first points of contact between the outside world and your internal biology. Every time you eat, drink, breathe through your mouth, or even talk, your oral tissues are exposed to microorganisms, allergens, and environmental agents. And your body knows this. That's why the mouth has its own localized immune apparatus, not just a passive barrier, but an active, coordinated defense system. A 2022 review published in the International Journal of Molecular Sciences described in detail how the oral mucosa contains multiple populations of immune cells, including Langerhans cells, macrophages, T lymphocytes, and neutrophils, all working together to maintain a delicate balance between immune tolerance and active defense. And that balance is key. When it works properly, your immune system manages millions of microorganisms quietly and efficiently. You never even notice. But when something disrupts it, whether it's chronic stress, medication, a compromised immune state, or sustained poor hygiene, the system can shift. And that shift may not stay local. Earlier, we talked about FDOJ, those areas of fatty degeneration inside the jawbone. A 2024 study published in Biologics examined this from an osteoimmunological perspective. The researchers found that in patients with jawbone marrow defects, there was a consistent pattern of immune dysregulation. Specifically, a shift in the Th1-Th2 ratio and a characteristic overexpression of the chemokine rantase CCL5. More than 80% of the patients in the study cohort showed this imbalance. Now, this is an area that requires more research, and I want to be transparent about that. But what this data suggests is that the jawbone may not be immunologically silent, and that chronic, low-grade immune disruption in the oral environment could have broader implications that we are only beginning to explore. This is exactly the kind of question that integrative approaches to oral health are raising. Not to make definitive claims, but to ask better questions. And in my view, asking better questions is what moves the field forward. So let's step back for a moment. Today we've looked at your gums, a tissue whose chronic inflammation may contribute to elevated systemic markers like C-reactive protein. We've looked at the bone, a living structure where degenerative processes can develop silently, potentially for years, without any symptoms. We've explored saliva, a biological fluid with antimicrobial, buffering, and reparative functions that most people have never considered. And we've examined the immune system of the mouth, a sophisticated network that may have far more systemic relevance than conventional dentistry has traditionally recognized. This is not just about teeth. This is an ecosystem. And when we reduce oral health to do I have cavities or are my teeth white enough, we are looking at a fraction of the picture. My goal with this series is not to create fear. It's to create awareness, to help you understand what your mouth really is, so you can take better care of it. In the next episode, we'll explore how dentistry became separated from medicine, and why that separation still affects the way your health is managed today. I'm Dr. Mario Parra. Thanks for watching. I'll see you next week.